We're delighted to be back with a new episode of Fertile Ground, bringing you expert answers around fertility and pregnancy from Dr Jyotica Ruba. We haven't recorded an episode for some time, Dr Jyoti. I'm very happy to be back recording with you again. How are you?
I'm really well, thank you.
Today, we're diving into a topic so many people quietly agonise over during their IVF journey, and that's about getting a second opinion. We're going to cover the when and why and how, but before we get to the logistics of that, can we address a bit of maybe an elephant in the room? Patients might or could often feel guilty or worry that they're going to offend their current doctor if they look elsewhere. Before we look at getting a second opinion, how do you reflect on when patients come to you or go to get a second opinion?
I think a lot of patients do seek second opinions. It's very common amongst IVF specialists. If another couple wants a second opinion, I do try and facilitate that. And I do understand couples do feel quite uncomfortable and sometimes almost like they're having to go behind their current doctor's back to get a second opinion. And I think that everyone should know that it's very common. Sometimes you're looking to fill some gaps, and sometimes you just get a better, maybe a little bit of a better rapport with people. Sometimes your personalities just click. Maybe they feel comfortable asking you certain questions compared to their current consultant. And sometimes they just want to know if there's something different that they can do. And I think that's a huge question that a lot of couples want an answer to. Is there something else we can do? Is there a different approach? Are we on all the right supplements? Have we prepped enough? Did we do enough when we did that cycle before? Or why did it not work? And often everyone is busy in the IVF space. All the consultants are busy. So it can be difficult to find the time to sit down with people after a cycle that doesn't work or doesn't work the way we thought it would. And I think it's very important to take that time to sit down with your couples or your patients and just talk through why that might be. And sometimes we don't have all the answers, but I think people greatly appreciate that conversation, and it helps them move forward and gives them a bit more confidence that we're listening and trying to rectify anything.
I think when it comes to having a conversation about second opinion, my head immediately went to, are there milestones? Are there a certain number of failed transfers or recurrent miscarriages or feeling dismissed? When and should you actively encourage getting a second opinion?
I think that the time that people feel that maybe they're not being listened to anymore, I think that's important because that can be a real impasse in feeling like you and your specialist are actually working toward the same goal. Sometimes you feel like they're not listening, or you have wanted to talk to them about a certain approach to a cycle and they don't believe it would work, but you need more information. That might be time then to seek a second opinion. But you're right, I think a lot of people do look for second opinions, sadly, after recurrent miscarriage, because that is a very difficult topic to go through. It takes a long time. There are some investigations that we need to make sure have been done. And I think that sometimes, there aren't good answers to why recurrent miscarriages happen. I know that sometimes we just don't have good answers for patients, and it makes them feel understandably really unheard, frustrated, and they really can't believe that sometimes there aren't any answers. And sometimes you need that reinforced by a second person. Sometimes you need someone to say to you, look, I'm really sorry, but that doctor's actually right. We don't have very good answers. They've done all the appropriate investigations, and now you can move forward. Sometimes seeking a second opinion at least can put your mind at ease that you've gone through everything and your current consultant is doing all the right things for you. And often after a second opinion, I'll say, look, I think you should go back and see your specialist. They're doing all the right things. And some people would appreciate that and gladly go back and see their current consultant. And some people do want to change consultants, and that's completely understandable.
That's really nice to understand, Dr. Jody. So if someone is or books in with you to have a second opinion tomorrow, what exactly do they need to bring to make that consult actually useful?
That's the best question. I think it is so useful if we can have as much information as possible. And I actually like to have it even before the appointment time, so I can actually go through it, understand what's missing perhaps from the information. And that way we can have a more productive, more thorough, and I think get to the right point much more quickly. Even though my first consultations with everyone are about an hour, when it comes to complex fertility problems, sometimes we need more time than that. And usually I try and invest that time in looking through results and trying to actually retrieve results if they're missing or not there, or trying to get some information from the previous doctor. Can take sometimes days, sometimes weeks, depending on the clinic that you've been to. So I do see a lot of people from interstate coming into Canberra, and obviously then it can be more difficult to get their records, and they may not realise that that might be very helpful. So retrieving those records, having them with you, I think is a good idea as you go through every cycle. Understanding what your consultant is doing for you can help another consultant understand perhaps what they shouldn't do next time, or perhaps what worked last time, and where they can tweak the cycle a little bit for you. So I think those things are so valuable, and I really appreciate it when patients bring all their information. So what might be helpful in their clinical situation is just bringing everything they can, including anything to do with their past medical history for both the people in the couple.
The one thing I would just like to go back to is if someone's able to provide all that information before an appointment, what are the logistics of that?
Usually it just involves contacting the clinic that you're currently seeing and obtaining cycle information. That information is usually within a computer system somewhere in a database, and they can activate that and then download it and send patients maybe a cycle summary. That's the most common form of communication between clinics. Is usually they will write a little cycle summary, which involves usually what medications are taken, for how long, what type of cycle is run, and how many eggs were retrieved. Then the embryos, and usually then we have a scientist report as well. So the scientist report then will report how many mature eggs were retrieved, how many immature eggs were retrieved, which is very useful to understand when we're running a cycle. And then how many embryos were created, how they were created, so whether it was straight IVF or another method called ICSI, which is injection of the sperm straight into the egg. So all of those steps can help us understand then how the embryos grew, and whether we got many day 5 embryos and mature embryos ready to freeze, and what quality those embryos were. The scientist report usually summarizes all of those things easily for us to read, and then grades the embryos themselves, so we understand whether or not they're actually good quality embryos and likely to produce a live baby. So it can help us modify the next cycle a little bit, and sometimes doing something different can feel more empowering instead of repeating a cycle that's failing repeatedly.
So do you see this very often in your clinic? People coming in and asking to try something different, maybe because their current specialist wants to do it in a certain way that the patient feels just isn't quite working?
I think, trying something different is a big thing in IVF. So people do seek out second opinions because they want to know, well, what else can I do? How else can I improve the cycles? We're often the couple's doing everything they can themselves. They're on supplements, they're on good diets, they've stopped smoking, they've stopped drinking alcohol. So now it's then our responsibility to try and improve the outcomes that they get.
I suppose patients often focus, on finding a new doctor because that's the person they deal with all the time. How important is it to take the clinic or the embryology lab into account when it comes to getting a second opinion as well?
I think that's a good question. I think it's difficult because having worked for a few different companies, I feel like the standards of the laboratories are all very high and the experience of the scientists are all incredible. Otherwise, a lab is run the same way in every clinic. I think stay with the same person sometimes is very helpful because they know you well. And even though they may not seem to be doing or being successful, they often do think every single time you come back, what else can we do? How differently can we do it? And can we achieve a different outcome? So I think those things are not lab dependent. And I think labs are fairly well standardized across Australia. I think we're lucky that way, that we have high standards for all of our IVF labs. But I think the problem is sometimes continuity of care. So some patients do skip around a little bit, thinking a different laboratory, a different company may give them a different outcome. But I think we also have to realize that, and I tell my patients this, that every month there's a different wave of different quality and quantity of eggs coming through the ovaries. Every month the sperm can be slightly different, slightly better, slightly worse. And that generally depends on a lot of different factors, but those factors are not measurable in some ways. So we can't tell about egg quality until we try and fertilize the eggs with the sperm, and that might give us an idea about egg quality. So there are some things that we can modify and some things we can't. And I think often sticking with the one consultant can be quite helpful, but in IVF, because it can be very difficult for some couples, I understand that everyone does move around, try and get a different opinion, see if there's another point of view, another way perhaps to look at the issues that are going on, or see if, the person they're talking to has a bright new idea or a different way of running their cycle. And you only know if you ask. So I think, if you're feeling unsure, I think it is important to ask, because then you're not being well informed if you're feeling very unsure.
So you do then see a lot of patients for second opinions?
I think second opinions seem to be increasing in my practice. And I think that's because of word of mouth in Canberra. I think that we have plenty of time, we listen, I get all the reports that I need to, we have follow-up appointments. I'm happy for them to continue seeing the clinic that they're seeing and the other doctor that they're seeing whilst I work in the background. I don't demand that patients come and see me and after an opinion stay with me. I think that's unreasonable. I think people are just looking for the truth, and the truth about IVF is that there is a lot of grey. There's not a lot of black and white, like a lot of areas of medicine. And there is a lot of nuance to running a cycle. And so I think that patients are very attuned to whether or not they're being led up the garden path, so to speak, versus listening and understanding and then explaining. Sometimes when I see their penny drop on people's faces, they're like, oh gosh, that's why they use this drug, or that's why I had this particular trigger injection. And, that's what it means when the embryos don't grow past day 3. Or, that's what it means when they keep putting embryos back and they're not implanting. So these are the investigations we do. But I think some of the consultants are very rote in their approach to how they treat patients and what they explain to patients. And so sometimes patients want to know a little bit, sometimes they want to know everything. And you have to be prepared to communicate at the level that those patients want to communicate at. And some want everything, and some people literally just say, you do what you have to do, and I'll say yes to everything. Everyone is different. So I think most couples, though, do want to feel like they're in control. They have good information, they're being communicated well with, and at the end of the cycle, they have a review of that cycle with their consultant, see what could be done better, or if they're pregnant, even better.
Yeah, thanks, Jody. Look, that's all super, super helpful. Thanks for giving us that information on getting a second opinion. Thanks, Jody.
No worries, thank you.
Thank you for listening to this episode of Fertile Ground with Dr Jyotica Ruba. If you'd like to make an appointment with Dr Jody, please visit her website at drruba.com.au or call her Canberra rooms on 02 6106 9991. We'll be back with a new episode soon, so go ahead and hit that subscribe button to be alerted when it drops.